problem came in when it on the issue of wage, and it is this 2.4 billion that we were unable to utilize in that financial year. And the reason was because that during that financial year, we had been given the money, but then Ministry of Public Service had stopped us from recruiting, not only Entebbe, but it was cutting across all the different MDAs of government. So it was only opened up in February last year, and then this was almost like towards the end of the financial year, and we didn't have much time to recruit, and then this is how we ended up returning 2.4 billion. But good enough, the same money was given back to us in this other last financial year, and we have utilized all the money that was given to us. So in that year, it was an issue of time, which became an impediment to this.
Well, have you planned to recruit more staff in this financial 2025-26?
Yes.
And how much money has been located to you? And how many staff do you intend to recruit?
For this coming financial year, we have been allocated. We are planning to recruit more people, and we have been given 1 other billion for wage, and we plan to recruit 21 staff under this.
And that pushes it what percentage from 21 to what?
Now 21 plus 26, that is 2, count 281. Now mathematics.
Let them calculate for you as we do proceed.
Out of 1195, and then we get a percentage.
Please get that percentage so that we can know the targets that you do have in regard to staffing, but we still take note that the staffing levels are still low.
Sure.
Because I doubt whether you will even exceed 23%. You'll be still below 25%, which is too low.
Sure.
And you know the consequences of understaffing. Number one, you compromise on the quality of service that you render to the people of the region that you serve. Number two, the medical workers are overstretched. So we really need to take this issue serious, much as we are allocated money, but it's still not sufficient for Entebbe Regional Referral Hospital to serve the population that it does have. You have a population of 4.3 million that is served by 21%. And you are the one who complains about congestion. The patients are many. The other time I told you, when one is told that you have been admitted to Entebbe Regional Referral Hospital, being close to State House and the criticality of that road, one might think that you are among the best hospitals that we have in the country. So Entebbe, we still take note of the challenges of understaffing. You don't have staff. Let's go to 2.2, that is review of critical service delivery in areas of the hospital. Human resource management, we have talked about that, about the structure, we're not going to repeat it. Understaffing, the same issue. Inspection of your stores. When the auditor inspected the stores to ascertain whether medicines and health supplies were stored in accordance with the storage conditions as recommended by the manufacturer, these were found out. Storage space was inadequate, pallets were available but not adequate, some drugs were stored in corridors, office consumables like stationery were stored in the drug store, newly delivered supplies did not have space to be stored in. How I wish these photos were colored. One would have seen the state of the stores of Entebbe Regional Referral Hospital. So, sir, what are you doing to really ensure that you have adequate storage? Because number one, this affects the drugs that you do store. And it is very dangerous to the patients. You might even end up giving us expired drugs because the stores person cannot know those that came in first and those that came in last. You just pile everything in the stores, which is so risky to the population that you do serve. So why don't we have adequate storage space for these medical supplies and these others? And why do you have the stationery stored in these medical stores?
Well, thank you very much. We have limited storage facilities at our place, and what we are doing as management, we are handling this in two ways. One, we have.
I want you to remind us, for how long have you been? When were you upgraded to a regional referral hospital?
2019. July
Those are 6 years.
These are 6
so
years.
A 6-year-old regional referral hospital cannot even have a space for storage of drugs, don't you think you are prematurely elevated? Because, honorable colleagues, if you cannot have stores, what else can you have? You don't have stores. Can you have wards when you don't have stores? This is a very serious matter. These are very, very basic, simple things. Anyway, give us the reasons as to why you don't have.
Yes. So we are approaching this in two ways. One, in a short term, we have requested for a 40-foot container from national medical stores, which we can use for storage in the meantime for some of the extra items that we receive. But
you have asked for a container from?
And national medical stores. The request is attached as an annex to this.
Is that within their mandate?
No, we got.
Director, why don't you plan for a container within your budget? Do you have to go begging? Because national medical stores, I doubt whether it's their mandate to give you storage. I doubt.
Now we got to know that they have some containers which we would benefit from, and then this is.
But within your budget, can't you afford to buy a container? For God's sake, within your budget, you can't afford.
The problem is that our budget is really, really very low. It is very difficult.
How much is a container? Have you ever taken time to look for quotations for a container for you? Ugandans should fundraise for Entebbe Regional Referral Hospital to have a container, say that you can have our drugs stored better. Because the loss that we do get out of expired drugs and the inefficiencies that come about in regard to poor storage, for us we can take a move to mobilize for you resources. We can run a fundraising across the country for Entebbe to be helped. How much is a container? Have you ever interested yourselves in getting a quotation?
Yes, the container goes for about 7 million, but the way we have done also is we have a longer term plan, and the plan is...
Director, a container of 7 million cannot be part of a long term plan. We have a challenge of storage. A container of 7 million becomes a long term plan. Really, are we being serious as Entebbe?
The long term plan is actually to construct a new store, and currently we are having a project that we are seeking for approval, Ministry of Finance.
What stage is the project?
It's at feasibility level now.
Feasibility. Do you have any money that was allocated to you in the next financial year in regard to solving the challenge of storage?
Yeah, what we have planned in the next financial year is for us to make sure that we get this in terms of development, constructing now this one, because there is no money that has been allocated to us for this kind of putting up capital development for buildings, but we have allocated some funds to see how we can get temporary storage.
Director, is the Ministry of Health aware of this challenge?
We have informed the ministry about these challenges of.
Do you have evidence?
Yes, we have. Evidence. We have communicated to them.
Which annex is that?
We have communicated to the ministry, generally telling them about the challenges we have with our low wage and money for maintenance of this. And this comes to annex number. There are some letter requests for support. We have written several letters.
Help the director. Director, as you do proceed, it's about the request
now
for...
Now go to annex number.
Go to annex 3B, request 3B, for yes. A 40-foot container for
Ministry of Finance, telling them, asking for more funds to support us on this kind of challenges that we have, and it is on annex 3B. You can first see annex 3A.
3A is to national medical stores.
3A.
This is 3B.
No.
Annex 3 is development committee decisions.
Now the one after that. The one after that. audits. There's something there to do, requisition of additional wage from the Ministry of Economy, Ministry of Finance. So we have tried to inform.
I'm looking for that one.
Even Annex 8.
3A. After 3A, I have 3B. The General Manager, National Medical Stores. Is that the one you are talking about?
5A,
Okay.
and 8. Annex 5A and Annex 8.
This is 6. The non-wage budget by 6 billion. Go straight and read where you talk about a container in your letter, because it is long. You can't read these many, there are so many areas. You look for where you talk about a container. And as your team gives us, you said the cost is 7 million. The other time we made people fundraise for you to get a bed. This time around, before you leave this place, Ugandans will have known that you don't have a storage space and they will contribute for you. I think even the people of Vuma Island. But Butambala is a beneficiary. The chair is here. Butambala is among those that are served by, by this very...